challenge for years has been to make sure that everyone has access to health care in our state and in our nation. And that did engender a lot of ideological disagreement, frankly, between Democrats and Republicans. That issue is pretty much resolved with the adoption of our health care reform. And I'm going to make sure that it's implemented in the state of Washington in a cost-effective way. So we've sort of got that battle, if you will, behind us. Sort of like the marriage equality battle. We got that that battle behind us now. It's behind us. So we can move on to some other issues. So now we've got a new challenge, which is how do we get cost-effective healthcare delivery system in the state of Washington that is so important to our business community. Our business community desperately needs a healthcare delivery system that can reduce the rate of medical inflation. It is the only way it can be competitive internationally. I think there is opportunities for a lot of bipartisanship in this field.
Yeah.
And the reason is that this idea of having a results-oriented medical and healthcare delivery system really is not one that should be an ideological cleavage between the parties. This is something we ought to be able to embrace. I have a very, very strong, passionate dedication to reducing the number of children in the state of Washington who are going to develop diabetes unless we figure out a way to reduce obesity amongst our young people and improve their nutritional habits and improve their physical activity.
So on a personal level, the whirlwind that is standing up a government, what is different than what you imagined? I mean, what is the thing where you're like, well, I kind of thought I saw this coming, but it was actually that over here?
Well, I got to tell you, this is a personal aside. Maybe you won't spread it too broadly, but this morning Trudy got up before I did, and I came down, and she said, "How you doing, Governor?" And I'm not sure she'd ever said that before. You know, and it was kind of refreshing to have some at least feigned respect.
Is there a particular way that you would suggest people communicate with your transition or new administration? Is there a point of contact that, on healthcare in particular, where you think people ought to be sending emails or policy ideas?
Well, DJ, you're a great point of contact to start with. DJ has been extremely helpful to me in the last year and a half developing our ideas on healthcare, and I hope you might continue to receive information and get it to me in that regard.